What's up, everybody? Shawn here with another Live to Roll. We're back with another good show for you this week, talking some catheter, bladder health stuff. So, any questions you guys have, definitely drop them in the chat, or any comments, anything like that. Let us know. Just say hi. All right, guys, you got the Quadcast crew with you here today. I have Shawn, C5, C6 quadriplegic from snowboarding accident 20 years ago. One of you, Bobby, go ahead, take it.
Yeah, no problem. Thanks a lot. I'm Bobby Rohan, C5, C6, uh, 35 years, and from a bicycle accident here in Southern California. And we got Mickey in the house already asking questions, so we'll get to you, Mickey. But first, we got to introduce the man of the hour, Tom.
Nah, not of the hour, not even of the month. I'm just kidding. I'm Tom Conaway, C6B, quadriplegic for the last, oh my God, it's going to be 27 years at the end of the month. Fudge, I'm getting old. Ugh. But excited, happy to be alive, baby. And yeah, excited to talk about bladder stuff. My bladder's kind of angry today. So it's very topical. And yeah, shout out Donna. Happy birthday, Donna. Love you.
That was my
Miss you.
mom's
Hope you're
birthday
good.
yesterday. Happy birthday.
Yeah, happy birthday. That was yesterday, Shawn?
Hers was yesterday, yeah.
Oh, that's funny. My brother was yesterday, too.
A ton of July birthdays. What is the
August, you
date?
mean.
Must
Yeah,
be.
sorry.
No, go ahead, Bobby. Let's address Mickey, unless he has something else.
No, well, I was going to say yesterday was my brother's. Today is my sister's birthday, so a lot of August. Yeah, I know we're going to talk about bladder, and so Mickey, we got you on the hook, and you're here, and you were asking about blood. I remember you texted me, and you saw a bunch of blood in your catheter or in your urine, and I don't know about you, Shawn, for suprapubic. If that's ever happened to you, it's happened to me 8 times in my life.
So I've had bleeding from bad catheter changes before, like excessive bleeding, like the 3 different times where they like went too far and inflated the balloon, and I don't know exactly where, but an area it shouldn't have. It ripped something open and like bled out profusely. Um, I have had bleeding from a really bad UTI a couple of times, and then I've had minor bleeding when I've gotten catheter changes, like just even everyday. But like that will literally just be like a tiny bit of pink. Like the first part of it will be a little red, and then it'll be pink and flow normal urine. So if you're having regular blood, I've never had that, and I don't think that is
Yeah, it's not
very good.
regular blood is not good. Obviously, we know that. But saw the urologist, is what Mickey said, and said it was probably irritation to the bladder from the suprapubic. Um, yeah, it is. It's basically that's what it is. That's what I've been told. I did a big trip to somewhere Alabama or for a quad rugby tournament. I remember getting there, and we finally get in the hotel, and after traveling, taking 2 planes, it was pure blood. Here I am in Alabama and middle of nowhere in Shreveport. No, that's Louisiana. What part of I forget what part of Alabama, but um, and I just had pure blood, and the whole weekend it was kind of like that. But basically, what I can say, Mickey, is, and I know you've mentioned I don't like water, and you got to learn to love it.
Yeah.
Learn that it is your best friend. You might as well have a second marriage, because that should be your second marriage, is to water, and flush that out. No more, if you are drinking any kind of soda, any kind of sugary drinks, like lemonade or iced tea, if you put sugar in it, no, just drink a lot of water and it will flush out. Um, so that's the best recommendation. At least urologist said, don't worry about it. It's, irritation. Um,
And,
I don't know if you did a tube change, but sometimes that can help as well.
and
I
Mickey,
haven't,
is it
bro.
like red? I'm sorry, you get to go, Tom.
Yeah,
Is it
you
red,
go, go,
red,
go.
or is it like pink? Like there's blood in the urine, or is it coming out like bleeding? Just out of curiosity. Go ahead, Tom.
I have a rough relationship with water too. I mean, I love it. It gives me life. But for some reason, I don't know. It's hard to drink in mass, like to get like a good quantity of water in my belly. I just feel full. Like I'm like, okay, I'm done drinking, and then I won't want to drink for hours and hours and hours. I had a nurse practitioner when I got my bladder surgery, and we were talking about hydrating and bladder health and stuff, and she said that she had the same problem, but every 3 or 4 hours she would chug like 20 ounces of water. Like she wouldn't sit there and drink in between, but every 3 or 4 hours she'd chug like a whole bottle. And I have a hard time doing that, but that's what I try to do. If I find that I haven't drinking for a few hours, I'll try to catch up and I'll just swig it all down real quick, and then I'll be one and done. And sometimes I'll be like, "Ooh, I got a water belly," but it makes my bladder feel better. And what Bobby and Shawn are saying is like right, like you have to flush. That is the best advice I'd ever gotten from any urologist that I ever had is drink like a fish. Like drink. Don't drink to you're like sick, but push yourself.
Yeah,
Bobby, it's
and
so loud.
what's that?
It's
Bobby.
so
Stupid.
loud.
Yeah, sorry, the dump truck would trash guy went by. Um,
If it helps you get it down,
no,
Mickey, I'd say it's okay. But honestly, just regular water, like what regular water.
if you really have to buy, and I was just telling, and maybe he's on today, Eric, a little shout out to you. He's a newly injured, doesn't he's trying to gain ground on this whole SEI situation. Reached out to me, and you know he says I don't like water, and I just said maybe try. They used to have, and I don't know the name brand, but a little drop, and it will just give it a little bit of flavor. It doesn't add a lot, but it's just to give it some flavor. Maybe try something like that. Crystal Light without sugar, sure, but your best bet is to just really down the water. It's just gonna. It's the quickest way to get rid of everything that's in that body or in that bladder. And the more you can do it for at least 2 days. If you don't see a sign, yeah, maybe call your urologist and go back. But yeah, and
Well,
see, and you,
go ahead, Bob.
Mickey, you're don't flush anymore right now. Just drink water because your bladder is irritated, and by you putting pressure with that water in the syringe, that's adding more pressure to your bladder. So try to hold off on the flushing. Flushing is really good for the catheter, not for the bladder.
Yeah, I
So
think it's more if
yeah,
you have an infection or symptoms of an infection. If you're bleeding from an irritation that's not UTI related, then I think what Bobby's saying is probably really good advice in terms of like don't further irritate it because yeah, the pressure of like the suction and pushing in and out certainly isn't good. And I just want to say when I am flushing my bladder, like I have UTI, and I'm not talking like flushing like irrigating, like I'm like drinking so much that I'm like peeing every 30 minutes because like I'm just drinking a ton. Don't forget your electrolytes. Like I'll drink a bottle of water and then I'll drink a bottle of like Propel or like Gatorade or something. It's like a lot of electrolytes. One helps your body hydrate, but also helps like me pee a lot more. Like I'll drink and man, it'll just make me pee like crazy. And that like your bladder filling up and flushing that stuff out from like your natural flush I think is the best thing you can do. And that's just what I do. I don't know if it's right, but I think the electrolytes are important.
yeah, no, absolutely, Tom. Because if you're gonna drink a lot of water and try to flush that out, you do need electrolytes, and Pedialyte is one of those. If you are drinking lots of water and you want to do your Crystal Light, I don't see a problem with that because you're just going to flush it out. But it's really, two full glasses of water to one, maybe even. And what I do with my Pedialyte, I don't know if you do this, Tom. but I dilute it a little bit. It's pretty heavy. It's heavy tasting, you
I
know.
don't do Pedialyte. I do like Propel or Gatorade, or I have
Yeah,
like
or there,
hydration packs, like Liquid
yeah,
IV or something like that.
yeah.
Yeah,
Liquid IV
they're
is
all good.
really good.
Anything that has that electrolyte, the little, and don't overdo it either. Don't overdo the sodium
Yeah.
and so
Well, and don't overdo it, and don't overdo water over a long
yeah,
period of time, because then now you're getting to where you're flushing out everything that you put into your body, and you tend to be on the low side of sodium, like somebody we know, and it takes a lot of work to bring it back up. It's not easy.
Leah just brings up something good too. I like to snack on ice. It's like really hydrating too. Like I'll sit there, especially if like these 100-degree days, if it's super hot, like it can sit there and chew on some ice, and that'll make me have to pee a lot too because I would be putting more body in my water in my body than I realize. Um,
Mhm.
and it's also like a way that I cool down. Like that's one of my
yeah.
big cool
That's
down
right
methods.
now, and stay hydrated for everybody that is out in the heat right now, because that is important for your bladder health as well.
I know I wanted to say just a quick shout out with our heat. Um, I, over the weekend on Friday, Saturday, and Sunday, went riding for very long rides, and actually throughout the whole week. And I was fine. I was okay. But then I went out yesterday to the U.S. Open surfing contest for the longboard championship before the Olympic pros get back in town, and they start, I think, tomorrow. And um, just being out in the sun again, I came home, I had to coach a class, and afterwards I had a fever of 100, almost 101, was really flush, and I can tell it was like a mini like sunstroke of just being out in the sun just too many days and the heat. So with the heat rising right now everywhere, just be very careful as a quad, even when you think you can handle it. Try not to do what I did, which is just too many days in the heat. And there's a lot of quads that love to just sit out in the heat and just bake, but
Yeah,
because it feels good to our body. I
if
know
it's
not you,
70
Shawn. You're
outside,
like,
I was gonna say
no,
if
no.
it's 70 outside, I'll go sit in the sun and bake for sure. If it's 98 outside like today, I don't want the sun at all. I'm out. Even the shade is hot. So
I was out yesterday. I got a little overheated. Nothing bad. I came home, squeezed the cold water bottle over the top of my head, and took my shirt off, sat in front of the fan for an hour, and I was ready to wrap up in a blanket. But I was out and I was waiting for the bus, and it was freaking hot, and there was no shade, and I could feel my body like starting to get there. I'm like, oh God, please let this bus come soon. I knew it was coming soon because I like had the schedule, but I was still kind of tripping. I was like, oh, please let this bus be like nice and air conditioned. I just want to get home. I don't want to get overheated, and I was able to get home fine. Like I said, I was hot when I came home, but I was able to cool it down. But yeah, it's a scary thing, and I don't know. Even 30 years, like it doesn't matter how long you're in the chair. Going on 30 years, and Bobby 30 plus, and Shawn, 20 plus. Like we've all had a lot of experience living with our disability, and the heat can still catch up with you when you least expect it. So the best way to manage that is to always be prepared. If there's even a small chance that you might get hot, you better come prepared at least a little bit, or have a quick out to get somewhere cool and comfy. That's kind of like what I do too. Is when I'm going out, like I always plan my trip, and I mean, heck, I'll dive into a CVS and go sit in the freezer section for 20, 30 minutes if I have to. Like, you got to, you do what you got to do. But it's just important to be mindful and stay safe.
There was one time I was overheated and was going to one store, but the grocery store was next door. And I went into the freezer section, opened up a door, and I was just there for a while. And finally, a store clerk or a store manager, who knows what it was, but some employee came by and just like, "Can I help you find something? Are you okay?" I'm like, "I still don't see what I want. It's a certain ice cream or what. I forget what section I was looking at, or certain meatballs." And he's like, and I'm like, "No, but I'm fine. I'm fine."
I
Hey,
used to love the Costco freezer walk-ins, like because
Oh,
you can
that
roll into
in
that
the
sucker.
summer, I've
Oh
done that
yeah,
one. That one's good. That one's good because it's
yeah, that
huge. You
was
just roll
nice.
straight through that thing. Oh, it's great.
I'll just do laps. I'll just do laps in there. Like people will be like going in, grabbing the thing, doing one loop. I'm just sitting there like moseying, doing laps.
Can I help you? Because I'm going to point out what you need here.
I'm like, no, I'm
um,
good.
I want to give a shout out to Chaffer Wheels. Earlier, you said he went to Thailand for 2 weeks and he brought over 200 catheters. Um, yeah, that's a lot of catheters, and I would still be scared that's probably not enough. And then he also said he used to play wheelchair tennis, always kept that towel around his neck, which is always a great idea. And the only thing with quads, when we do something wet, it's just not good enough after a while because then we want it cold again. And it just like,
You have to keep refreshing it.
yeah, it's
That's
just
this.
so hard to keep.
I've been addicted to the spray bottle again this whole last week, like rugby. It's like crack. Like earlier today, I was spraying, and like I'll just douse my shirt so where it's literally wet stuck to my body, because that's just it feels good. It breaks the heat. So
I
that's
went
been
to
all week.
Yep,
I
I'm
went to
with you. Go
go
ahead.
ahead.
Get a Costco
No,
name
you
tag.
go, Bobby.
Oh, I was going to say Chaffer Wheels. Yeah, I'm 35 years and counting. So, but hit us up, one of us up on Instagram. I'd love to hear about your trip and maybe have you as a guest. So,
Or shoot an email. That works too.
we don't display our email and our
I
information.
do. I
Tom's
do. I
Oh,
Tom's
do.
info's out there.
okay. I'm sorry. I'm sorry.
I do.
Or shoot Tom an email.
Tom's
Old
preferred.
school.
Yeah.
Old school.
Uh,
Um,
I also wanted just a
but
real quick shout out. I guess Andrew says he's in Paris right now. Are you there for the Olympics? Are you going to stay for Paralympics?
He's all
Oh,
over.
and it's his
he said
birthday
he
on
was
Thursday.
watching.
Happy birthday.
Happy birthday on Thursday. Andrew,
Uh,
also, man, I want to know where we can find your funds because you're all over the
Those
place.
guys been traveling the
I love
whole
it.
world.
Yeah,
Like,
always on a cruise for 2 weeks. Like, let us know what inside trading you have.
all
yeah.
right, guys, so we can get back to a little bit more of a. So
Mhm.
we talked a lot about super pubic. If anybody has any other questions for that, let us know. Tom, do you want to talk a little bit about your?
Yeah. Can I just give a little overview of all things bladder for like just a couple minutes, just to kind of give like a rough overview, and then we can each talk about our experiences and stuff.
Sure.
For any newbies out there, anybody who just looking for more information on bladder management and ways that people with spinal cord injuries do it and other similar disabilities, these are kind of the main ways that we do it. Um, I there's intermittent catheterization. I did that for a number of years, which is just like through my urethra. Regular catheterization, like lubricate the catheter through the urethra into the bladder every 3 to 5 hours. That was like my schedule for intermittent cathing, and did that for. Yeah, go ahead, Bobby. What were you gonna say?
Oh no, I was saying peace to Chaffer Wheels. He had to
Okay.
head out, but
Yeah, thank you, Chat for Wheels. We appreciate you stopping by. Um, the other, so I did that for a long time. The other main way that Shawn and Bobby manage their bladder is a suprapubic catheter, and that's not intermittent. That is what they call an indwelling catheter. It is through the pubic area. It's surgically placed. It is the tube that goes right through your pubic area, straight to your bladder, and it stays in place. Shawn, how long have you had yours? You're muted.
oh, he's on mute.
Sorry, I've had mine for 19 years now. So
And they change the tube occasionally, but otherwise, like the hole stays open. Like it's
well,
just like this access point to your bladder.
yeah, it is, and I'll explain. I can explain some of the changes if you want, real quick. Like I originally started doing it once a month with changes, but I had issues with sediment, so I went to 3 weeks, and then recently this year I've actually gone down to 2 weeks because of the sticking and bleeding and things. So I have had to make changes. It hasn't been the same, but yes, it's an indwelling. The hole's been there for the 19 years. I just always have to make sure. The one thing with it though, you can't take the catheter out for very long. Like If you take it out for the day, it will
Yeah,
close. The hole will close.
yeah, yeah.
Sorry, go ahead, Tom.
Um, no, that's perfect. That's what I was looking for. And Bobby, we can talk to about your experience too, but I'm just going to continue on with kind of the echelon of methods for catheterization. Some individuals don't use any indwelling things. For guys, sometimes they just get away with a condom cath. It's usually if you're like a lower level injury, like paraplegic, which is just like your body can go on its own, but maybe still has difficulty with incontinence and stuff. And it's just kind of exactly what it sounds like. It's a condom with a catheter attached at the end that goes to a bag, and is how some people manage it very successfully. And then there's my method, which is a little abnormal. It's generally more for younger individuals. I don't know the specific reason why it's generally done more for adolescents, but I do know some adults, at least younger adults, their 20s, that have gotten it done. So I do know that it is an option if you are a little bit older. I got mine done when I was a teenager, but it's called a Mitrofanoff procedure. And I basically have a second belly button right next to my regular belly button, and it's a hole that's a port to my bladder. It was a surgery that I got in high school, freshman year, and they took a little bit of my small intestine tissue, and they built like a port that's right next to my belly button on my abdomen, and it makes it so that I can still intermittent cath, so I don't have anything indwelling. I don't have like a tube that's permanently in place or that I have to change regularly. I
Hey,
use a
Tom.
self cath.
Tom,
Yeah,
adjust your wire or something.
no.
We didn't lose you, but it. You know.
You're gonna.
I'll go, and I was just going to say, I know Tom was trying to talk. Try to talk again, Tom. Or did you fix it?
I think I fixed it now. Am I back?
There you go. Go for it. Yeah, keep going.
So I, and again, this might just be a personal bias. I have a super sensitive bladder. Like the idea of something being indwelling and kind of permanently in there, like causing feelings and stuff, it kind of freaked me out, which is why I shied away from the suprapubic. Well, like my doctors were recommending it for years as like kind of more long-term solution, especially when it comes to like independence and independent living, because it's something that's reasonably manageable. I met a doctor who was helping me with some other bladder issues I had, and he turned out to be a really prominent surgeon and specialized in this type of surgery, and thought that I would be a huge benefit to getting it in terms of like attaining independence and managing my bladder on my own. And it changed my whole life. Like I needed assistance catheterizing all throughout my adolescence, but a couple months into this thing, I catheterized myself for the first time. And I just like catheterized through my abdomen, just like I would through my urethra, except it's just much easier to access. I just have to lift up my shirt. It barely looks like anything. Sometimes, like, I don't know, that was definitely a concern I had at the beginning. It's like the vanity and stuff, like this hole in my abdomen, like what that might look like. Honestly, you can't really tell. It like barely looks like anything. It almost looks like a scar next to my belly button. And it's super awesome. It allows me. I still cath every 3 to 5 hours. I use a catheter kit, which I can grab and bring over to show off what I use. But it really changed my life and was like a huge, huge positive for me. And it's another way that they manage it. So just kind of go through the list. We have um, Mitrofanoff, which is like access through it's called a urostomy, a port in my abdomen. There's a suprapubic, which is a tube that's indwelling, semi-permanently in place, in that you do need to change it every few weeks or every month, or depending on your schedule. But it is indwelling, permanently indwelling and in place. And then there's intermittent catheterization, or something like a condom catheter, which is passing through your regular urethra and or managing it through one of these other means. So lots of really interesting, cool methods. Bobby and Shawn use the suprapubic. That's probably what we are most specialized or have most information and experience with. I have a lot of experience with the Mitrofanov and my urostomy and stuff, but it's pretty uncommon. Not too many people have it, so I feel like I have a hard time. It's just not super relatable to people in mass. But Bobby, maybe you could talk about your experience with the suprapubic.
Yeah, I can. First, I'm going to shout out to Olivia. Put up a fun fact from Coloplast Rep. If you IC when removing the tube, rotate it completely before pulling out to get the remainder urine, and nothing remains in the bladder to reduce UTIs. Good thought. I like to hear that. Maybe I'll try that when I take out my suprapubic. I don't know if that's an option. And then Chris asked if we use like a certain acid to flush.
Acidic, yeah, an acidic
Acidic,
solution.
yeah. I don't use that, but I use vinegar, white
Okay, so
vinegar.
that's the same type of thing. I've never used vinegar, but I did used to for several years. I did use an acidic flush, like an acidic solution. I forget exactly what the acidity, the pH acidity was, but yeah, it was prescribed by the doctor. I mixed it 50-50 with just sterile water and would flush because the acidic solution stuff was too strong into my bladder. Like it would give me a little flash of AD if I flush it in on its own.
Yeah, and the white vinegar for me, I can control it. I just put one cap or two caps depending if I'm doing 10 cc's or 5 cc's. That seems to work right now pretty well. So yeah, Tom, you're right. I've had the suprapubic icing for capping. At the time, was not really a big option for me because of the hand function um, and just I thought like I can get away with the condom cath, and I'm like, if that's what I have to do for right now, that's what I have to do. But the problem was that I kept breaking out um,
Yeah.
and getting some scarring on there. And I was still in the hospital still in rehab when my OT told me about it. And then this gentleman came in, told me a little bit about it. And then he just said, one of the best things was, and Leah, you'll probably get a kick out of this, was about sex is really easy. You don't have to take off the condom cap. And I'm like, all right, where do we sign up here? Let's go. So 35 years ago when I was still in rehab, so I've had mine on for 35 years. The first, I think, just like everything with our body, the first 20, 25 years was going great. And then little things, started, happening more UTIs or now I've gone to what Shawn is changing my catheter every 2 weeks. And but I haven't changed size. I'm not the same size. When you have that type of indwelling catheter, you can go from 18 French to 24.
I have a 24. I don't know if it's bigger or not, but I have a 24. Yeah. That's what. So I found that's another thing that's actually changed
I
today.
use a 14.
Well, that's because that's going in your.
I see,
yeah. That has to go in and out like through the small port.
So does yours. In different hole.
I got a giant.
No,
It's a big.
Hey,
it's a
wait,
big hole.
Tom. No, we have bigger.
All right. Okay. You know what? I'm gonna let you have that one. Okay. I'm all good. I'm all good otherwise.
But I've been using the same. I went up to a 24 French like within the first year or so because I was getting so much sediment and clogging. But I've been using the same barred latex catheter for like 18 years now. And today was like the first time I'm trying the barred silicone ones. Exact same size, exact everything, except for it's silicone. And so far it's okay. am having a little more AD and irritation and leaking because they're more rigid than the latex. So that's just another note. And Bobby, You use a latex that's silver coated, or what do you use?
Yeah, so I use the silver alloy coating latex. I couldn't do the one you got. I tried it once, and 2 hours later, I'm like, you got to pull this thing out. This is ridiculous.
Well, that's what happened when I tried a silicone one, like maybe 12 years ago. It was a long time ago. It was but it was literally rigid. It felt like plastic. When the dude pulled it out, I was like, that looks like hard. Like it literally like bent and then like went back straight. I was like,
Oh my god. No, no,
no.
no, 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 no.
I'm like that
No,
doesn't
no, no,
seem,
no, no.
that seems too hard. And I was the same thing. Like within hours, I was like, no. I was like, get it out of me. I just was AD flushed, peeing everywhere. It was terrible. So.
So what is your doctor's thinking or idea or reasoning, I guess I should say, of why try the silicone? Is it
Well, for
less
one, I,
irritation?
I might go back to latex, and the every 2 weeks seems to work, but less sediment and crustation on it because like that's what was happening at the 3 week mark. Is by the time it would pull out at 3 weeks, it would be encrusted with sediment. Like it would literally have like crystals growing off of the catheter.
Yeah.
So when you try to pull that through the hole, it's got shards.
Jesus
Like
Christ,
that's
dude,
why I
that
was
is
bleeding.
wild.
So that's why we went to the 2 weeks because like it was literally bleeding every time they took it out.
No,
So
no,
it's
no,
just
no, no,
like
no.
so that's the reason why the silicone shouldn't let the crystals like it won't adhere like they will to the latex because the latex starts to break down. Like you look at it when you pull it out. And I don't know if yours is, but like it's a completely different. The top of the catheter is yellow, the bottom's white, and it looks like fluffier. Like it's literally losing its like it's breaking down almost. Like it seems like. I don't know if that's what's happening or not, but that's what it looks like on the outside, and it sticks to me for whatever reason, or like it grows to my bladder. I don't know, man, but that's why I'm changing it
Um,
because the silicone.
does the increased frequency help? Like normalize it?
So
Like,
the
is it
increased
not
frequency
like
has helped a lot
okay?
because I'm not getting any bleeding, and then the other thing is the last two changes. Well, I've been doing the last like 6 or 8 changes in the doctor's office after I had to go to the emergency room the one time. But the last two, Leah changed in the office, and we're gonna start to just do them at home. She's gonna do them for me, um, and her two, the last two, have been really good. Last time was the first time I had zero blood, and I didn't like. We showered afterwards, and I didn't pee on myself. I didn't have AD. I didn't have bladder spasms. I had nothing the rest of the day. So the silicone one is not doing that quite right now, but hopefully it'll get better.
I like how you said we
Uh,
showered after.
We did not shower.
uh,
That's what Shawn said.
I think
Sorry, I have a dirty
Chris
mind.
made an important comment. He says, "I've always intermittent cath. He says not always easy or convenient, but after all this time, it's what I'm used to. I, what if it ain't broke, don't fix it. If it works for you, and it works for you, like if it's what you're used to, it's what you're used to. I think it's good to know that there are other options out there if things kind of come to a head and like you're like, I don't know if I can keep doing this, or like the stress or the strain or the discomfort on your body is too much, then it is good to know that there are other options out there. And I'm just also going to say, I don't know if any of these methods are easy or convenient. Like the idea of managing your bladder through kind of a non-traditional means, like using tubes and stuff, it's always going to be kind of inconvenient. It's always going to be kind of a hassle. I mean, there's certainly times where I think you can it can get easier and you can find a routine and it can work, but there's going to be moments where you're dealing with an infection or you're dealing with discomfort or some kind of side effect of it. And um, it's just the nature of paralysis. Like the body is amazing in the ability to adapt, but we're not really meant to be paralyzed. And just like what Bobby said, after 20, 25, 30 years, like start to experience some different things as a result of this paralysis stuff that we deal with. So being able to deal with it, understanding there are different options, and being having the ability, the capacity to make a change, or figure out what you need to do to manage those symptoms, or to figure that out. Educate yourself. Educate yourself.
And this is why we're here, Chris, Art, and for a lot of you is that go in and ask questions about options. Like, um, what is there anything better for me because I have a little bit of a hard time to open my pants to icy, or um, is there anything different because the super pubic's not working out for me? Ask questions to your urologist. They're just going to go through the check boxes, and if you don't hear about these other things or don't research what could be easier for me, you sometimes, and I'm not trying to give you a hard time, Chris, but sometimes you just be stuck with the same old thing, and then after a while you're like, well, and like Chris said, I think I'm just kind of used to it. So ask around. And Jay, I'm not sure what the flip flow valve is. I'm curious to know that, but he also said but he
Yeah.
still gets a lot of sediment buildup and plugging. And it's going to happen. I mean, with suprapubic, it's just going to happen. I don't know anybody who it doesn't happen to. The best thing I can tell you is flush every other day or every day if you feel that's necessary. Take your vitamin C, and that goes for everybody. You want good bladder health? Take your vitamin C, is what my urologist says. It's just like start there. Then start with Demono's cranberry. But if you're not getting the vitamin C, you're doing a disharm to your bladder for having an indweller catheter.
It's a super scary thing when you start to have problems and you've been doing something for years and everything's good and everything's functional, and then you're like, shit, like this is hurting. This is bloody. This is not emptying completely. This is not working the way that it generally works. And it's like, okay, where do I go? What do I do? I'd say always, always, always number one, get a urologist. Unfortunately, sometimes the run of the mill local urologist isn't going to be your person. Sometimes you got to be a little bit more adamant with your insurance and honest with your you know doctor and stuff, and like, hey, if there's possibly anybody with any experience with spinal cord injury and this like long-term stuff, like that's what you want to find. That's not an option, like just do your best to try to find somebody who's confident with their experience and treating you. I've just had some urologists in the past that have hurt me, like literally, like done things that have like triggered AD and caused me to bleed and like made me feel super uncomfortable and not confident in their ability. And then I found ones that did have experience and I felt a lot better and more confident with. I'd say that's always number one. Find a urologist that you're comfortable with, that you can be honest and have good conversations with. And then, one step at a time. Little changes, give it a little bit of time. It sometimes can turn into progressive, positive, more meaningful changes. Supplements, always easy, simple, good thing to start with because it just is hardly cost nothing to take a pill, take a vitamin C or a D-monos or whatever that is. If that doesn't seem to have an effect, try flushing. That doesn't work. More drastic changes. Um, just track all this stuff, write it down. Um, be mindful of the changes that you're making and how your body's reacting to all of them. And don't do anything, I wouldn't say, unless you're really hurting and you're AD or you're not peeing or you're having a hard time, like don't do anything too drastic or too crazy, like I think sometimes small little changes like adding regular irrigation or like finding a different kind of catheter that better suits you, works easier, better, sometimes like that can be big and meaningful. And
Yeah,
diet, nutrition, Leah just said it, can't say this enough. um your what you drink really affects how your bladder feels, whether it's soda or alcohol or anything. Like, I'm not saying you can't enjoy those things because I do enjoy those things, maybe too frequently, namely the alcohol part. But man, oh man, do I notice the difference immediately. Like, if I go out on a Friday and have a couple drinks, I know what to expect for my bladder. I know I'm not going to be feeling good. I know I have to hydrate extra and cath more frequently, if not that night, the next day. And all that stuff's super important. And sometimes the environmental factors you're putting into your body it has a surprising effect.
yeah.
I was
Olivia, tell us why demonos hate you. What happens? And then for Jay, the suprapubic catheter, um,
with
where
an
do you put it?
emptying valve that I
Yeah,
drink during the day.
there's no way. Maybe if you start off that way, where your bladder's big, if you started off that way, but to switch over after 35 years, my bladder
Yeah, but
is
bladder won't hold
pretty
anything.
small.
I have to
Yeah,
pee every 10 minutes.
yeah. Peeing or putting like 15 cc's of water, I can even feel it. Like, oop, let's stop, and then I just put it into the tray and just watch it all drain out right away.
So,
So
and Black Olive Olivia just said too that high sodium intake also increases calcium excretion, which causes way more sediment. And I know that this high sodium stuff, if I eat a really high sodium meal, um, I will have a lot more sediment in my bladder that night or the next morning. So I know for sure that does affect me.
Olivia, you
Um,
had to go there. You had to tell me that. Jeez.
Chris says they really like their urologist now, and we've dialed things in pretty well right now to keep UTIs down to a minimum. And I think that's like a really apt like description of figuring out your bladder is dialing it in. It's gonna take some time. It unfortunately isn't an overnight thing, and gosh, I wish it was, but it can take months and sometimes. And I'm not saying this to like scare anybody or anything, but I just want to paint a realistic picture. Sometimes it can take years. I struggled at times. I struggled with my bladder for a year or two with more frequent infections, more common accidents and stuff while I was figuring things out and trying to change and figure out what was going to work for me. And I'm not saying that that's going to be the timeline for you, but expect, some weeks and some months and trying to figure this out and let your body get used to whatever it is you're trying to do. It's not meant to like scare you, but realistically, it's kind of what the timeline and what it takes is. It can just take a while, and in the midst of that time, it can be a little frustrating, or a lot frustrating, or a lot embarrassing, or a lot uncomfortable and painful, or a lot of all of those things. And it's important to stay vigilant, to, like I said, write down how you're feeling, track what you're doing, kind of catheter you're using, like how much volume you're getting out and stuff. Really does help me understand kind of over those weeks and months what is going on with my bladder in terms of just trying to like remember, like, oh yeah, a few months ago I was kind of feeling this way, or this same thing was kind of happening. I think it can just help over time. Have a little journal, track some of this stuff. That's just me. That's just my advice.
that's good. Good.
That's good, man. And Chris had mentioned that for a while he was buying his own catheters and was only getting a 30 a month, so he was washing and reusing them for the day, which I know people used to do and still do, but I would never not recommend that. Figure out some way to get them through insurance or something you can do. So,
Yeah,
yeah,
oh
Olivia
gosh.
also explained about her.
Yeah.
She thinks it maybe creates the wrong type of bacteria. So I don't know exactly what that.
Well, yeah, and also a lot of times when you have a UTI, more demonos is preventive measures than treating the UTI. So we're trying to prevent the UTIs with your vitamin C, your demonos, any other kind of supplement that you might take, um, whatever it may be. But if you have a UTI, things are going to work in the opposite. So, like, I take something called menamethy, which is
Methylamine, I think.
Yeah.
yeah,
Methylamine. Or
I always
Hippurexis, I think, the more.
yeah, Hipporexes, and that manages it. But my urologist said, but when you have a UTI, don't take it. It's not doing anything.
Well, when I've taken antibiotics for UCI, there is a reaction before, like the doctor and the pharmacist told me I cannot take the Hipporex with the antibiotic. So they
Right,
were like a because it's not an antibiotic, it's but it's a
antiseptic.
antiseptic. So yeah, it's more
Yeah,
preventative bladder health. And yeah, I do those daily. I do D-monos daily, and I do cranberry daily. I do cranberry in the morning, the Monos at night, and then the Hipporex one in the morning, one at night, both.
Yeah.
So,
Get your
Dang, you
vitamin
be taking a lot of stuff.
get your vitamin C in there.
hey, what's up, Mark? The Mark Network in the house. Thanks for joining, bud.
I don't do really anything in the way of like supplements for my bladder, which I don't know if that sounds like a little Wild West or a little crazy. I used to do ditropan when I was catheterizing intermittently through my urethra, and that was just to help with like my bladder spasticity that would like cause leakage. Um, and then once I got off that, I got off everything. What I did want to mention earlier that I do is I do. That's funny. Um, is I flush my bladder twice a week, like with a irrigation, like a 60 cc syringe. I'll take 60 cc's of water. Just again, maybe this sounds a little wild. I don't use saline water. I just use regular tap. I was told by my urologist that it was okay, and it hasn't seemed to cause me any increased infections or any ill side effects. So that's what I've been doing for the last 14 or 15 years. And I'll just flush twice with two 60 cc syringes, like in and out. Now, I think that helps with just regular bladder health, maybe flushing out any bad bacteria. But because I had this because of my surgery. I had an additional surgery. I had what's called a bladder augmentation, where they took some of my more of my small intestine tissue and they sewed it onto my bladder to increase the capacity, make it a little bit bigger. Reason I needed that done is because I was injured in my adolescence. My bladder never grew to full capacity as a side effect of my paralysis, and they had to augment the size artificially. And the result of the tissue that they use, the small intestine tissue, is made up of these cells that are compatible with your bladder tissue, but they are different. They're called goblet cells, and they produce mucus because that's what the lining of your small intestine does. And because of that, I get like mucus buildup in my bladder. Most of it just comes out during my regular catheterization. It's just kind of like sediment, but I do irrigate a couple times a week because it does have a chance to build up, and the irrigation can help flush that out. And yeah, I got a sexy bladder. That's a fact. Thanks for that one, Olivia.
Uh, yeah, no, but that is so you do it twice a week then the flush.
Twice a week, yeah.
For some reason I thought you had to do that daily, but that's cool. I was gonna ask
Um,
you one thing earlier.
I did when I first started. And again, this is something that my doctor did say, like it
You
might
can
decrease
static.
over time. Go ahead.
Um, well, I was
You had a
actually going
question.
to ask you when you get that fix and come back, what prevents that hole from closing, like versus the super pubic? Do you know? Because I know for ours, like, because yours is just open all the time, and then you have to intermittent cath. So I was curious when you were talking about it earlier. I was going to ask you um, how once you're back. Go ahead, Bobby. Yes.
Well, I was going to say most likely, and maybe Tom's going to answer it. No, Tom. Um, it's kind of like thinking about pierced ear. You take out your earring, by the end of the day, it could start, closing up. But if you do it 4 times a day where you just put it in there, it's not going to close up. So if we took out our suprapubic, a couple hours later, we put it back in and then take it out, it's not going to close up. And I believe maybe that's what for Tom as well.
It's a little different. There's
Okay.
two cool things about it. When they first did it, I had the tube in for 6 weeks permanently, meaning like it was in place while it healed around the tube. And right at the entrance of the augment, the urostomy, like the port of my abdomen, there is it's like a little bit of scar tissue, like right around it, and it doesn't allow it to heal up, at least not in a few hours. I've had issues since then where I like was cath like through my urethra because it's still an option. I've like had an indwelling. Like I've not cath through it for a couple days and it's been fine. Like there was no risk of it closing up. I think that may become a thing if you don't use it for months and months or something. Again, I can't really speak to it because I've never really faced that. But there is a little bit of scar tissue that and again, the different kinds of tissue, how this all works, how they do this surgically. I know that the tube had to be in place for 6 weeks while it healed. The other cool thing that I want to mention about it, which I think is really awesome and amazing, um, is is it the iliac valve? I don't know. I don't think that's it. But it kind of works like that. The way there's like a fold in the tissue. So when I push the catheter in, there's like a point that I have to push past, and it's like a fold in the tissue. But the amazing thing about it is the reverse pressure from inside my bladder pushes that fold closed so that it doesn't leak. Like, and I don't know. That's like one of the first questions everyone asks is like, well, it's like a hole in your like abdomen. Like, does it leak? And maybe if I have a bad UTI, a couple of drops here or there, like if my bladder's spasming like crazy, but very very rarely does it leak, and it's because of like cool engineering with tissue. I thought that's pretty amazing.
No, that is cool. That's what I was
And
curious about, just at how they do that. I did the doo too. How they do that,
um,
super cool.
I do that too. Um, and I'm sorry if I don't mean for this to be Tom's TED Talk. I hope I'm not talking too much. If I am, just tell me to shut up.
No, no, you're fine.
Um,
But hey, I just want to give a quick shout out. Chair Life, Chad is in the house. Chad, I got it. Thank you so much. He sent us out our little reachers. I'm super excited. I've already used it to get my other reacher when I drop that. So these things are awesome. Thank you so much for sending that over. If you want to learn more about these little hook reachers, and there's two sizes, he sent me both. One is a little bit longer and then one shorter, and they're amazing tools to have around the house. I already used it to close the lid to my barbecue. So I put, or
Probably a
actually my
good use for
smoker.
that. Yeah.
So I put it up, and then to get it, I can't pull it down. So I go around, and then I just push the lid, which is probably after a while when it slams down, it's not going to be great for the edges or the lid itself. So I used it for that, and I think my short one is going to stay out there permanently, but I brought it in because I wanted to say thank you. Also, I have to give a shout out to Chad. Chad wrote me a letter, and he wrote it. Our C56 quad friend, he actually wrote the letter. Sorry, Chad, if I'm going to embarrass you, but I love the
I
quad
love it.
handwriting. I would never do this. You're braver than I am. I would, and nowadays I'd probably just AI it, and
I
and then
You're literally
encourage every
replacing your own words.
quadriplegic to try to write. I enjoy writing regularly, and like it's one of my favorite tasks, and it's a fun use of your hands. You mean it, if you can figure it out, just that's my 2 cents. Go ahead, Bob.
yeah, no, I mean, I wish I was like to write like you do, Tom. I'm poor at it. I
I
look at
think
a
I
piece of
think it's super awesome. I applaud the handwritten letter. I think that's amazing in
no,
an age where that's seldom done. So
oh yeah,
that's great.
and being on a board of directors, I have to write thank you letters. I dread the days when I have
Oh,
to do it.
the AI
But check
age,
out,
It is a
Bobby.
good
It's
thing to
like
practice though,
so
because
well.
we don't have to do it much anymore. But it is a good skill to maintain. Because anytime I have to do more than sign my name, I am like, damn
well,
it.
the worst is, and I got one more product to thank, but if you want to check out Chair Life and that reacher, he was on our show, what, 2 weeks ago?
A few
Yeah,
weeks
Or
ago, yeah,
Chad.
2 3 weeks ago.
Chad was
3 weeks?
awesome. I think it was
Yeah,
like two
check
or
him out.
three.
He showed all his great products. Um, but don't you hate it when you go to a new doctor or something where you have to fill it out and they hand it to you, and the
Yeah,
spacing is like impossible? You're like, are you kidding me? I'm like, I mean, most of the time I'm like, yeah, you're gonna want to write this because you won't be able to read my writing. So
I'm checking my mail right after the show, Chad. I'm really excited. Super hyped for some extra grabbers. And hey, before we do the ads and wrap up the show real quick, and the shows, there's just quick catheter fact I wanted to drop because I just think
yeah,
it's super fascinating. And I learned this a long time ago. So rigid catheters have been around for thousands of years. Like rigid catheter is
great.
like bamboo shoots and reeds and things like that. And man, now imagine that. Imagine that.
Ooh,
No, 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 no. So the flexible catheter didn't pop up until 1782. And who invented that? Benjamin Franklin
nice.
invented the first flexible catheter for his brother-in-law, and it wasn't 1782; it was 1752. My bad. And I just thought that was really amazing. The guy who's on the $100 bill invented the flexible catheter for his brother-in-law who was suffering with some really severe bladder stones, and he invented a flexible catheter tube to help him alleviate his discomfort and pass those things easier. And I don't know, I just thought that was amazing. And the indwelling Foley catheter came around just 80 years ago by an American urologist named Frederick Foley, who invented and developed the Foley bag and the retained catheter. So I don't know, I just thought it was real fun and interesting, especially the Benjamin Franklin part. But thanks for letting me
No,
nerd
those are
out for
cool
a second.
catheter facts. Those are really good.
Yeah, and there's a reason why when you first had a spinal cord injury in the early days, they're like, "Oh, you might as well die. There's nothing we can do for you." Then it was like maybe 5 years. Then it's 10, and then that Foley catheter probably came out because they for a long time up until the 1900s, you weren't living more than a month or so.
So
Or
what were they using for lube with those straight things too? I mean, Jesus, right?
I
Water,
don't
just
know.
watering it up.
probably like
No, they
Bubba
probably
Dub.
give him some like opium or some laudanum or something and be like,
Something.
I'm real sorry about this. Like,
Shawn, you hawk tui on it.
Oh God.
oh no 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 no
But I
no
also
no.
have one more shout out. About a month and a half ago, Easy Hands, 2 months ago, Easy Hands
Easy hold.
was on, Easy Hold. I'm sorry, Hold. I can't read backwards. Was on our show and sent out a bunch of these for me. And I know Tom's got some on his way, and they're great. I using it for my shaver to shave my head now. Just in the last couple months, I don't know what it is about my shaver. It's just slippery every time I'm trying to shave and having a hard time. So it helped tremendously. So thank you, Easy Hold.
Sweet.
Awesome. Yeah. Thank you. Yeah. I still actually have to send her Tom and I's address. So hopefully we'll get some of those too. I just had slipped my mind, and sorry guys. But yeah, those are awesome products. And
You
we have
don't gotta out yourself live, Shawn. You don't have to out yourself, bro. It's all good.
It's all good. That's what. And a shout out also to Mark in the chat right there. He's been actually going with the Mark Network. He's had a booth at all the Abilities Expos, and he's been nice enough to he has a Live to Roll show flyer he's displaying on the table for us because he's an awesome ally and friend of the show. So make sure to check him out. And you can watch. We had him on the show back, I think, in maybe April, I believe. So if you want to check that out, it was a cool show. Really cool guy. So check that out, and we appreciate you. And yeah, and they have a really cool app. It's a social media app, so you guys can download it.
Go check out the Mark Network.
And shout out to Rebecca too in the chat. Thanks for joining, Rebecca. You were on our last Bladder show 6 months ago, so thank you. We try to do a new Bladder show every 6 months or so, a couple times a year, since it is so important to us in our health and daily living. So, yeah, thank you for everybody watching. One of you guys want to do sponsors or?
I got it.
All right.
Shout out
Yo.
Mobility Professionals, the premier DME company here in Southern California. If you find yourself in need of a new wheelchair, first time wheelchair, shower chair, standing frame, other similar durable medical equipment, they got your back. It's everybody knows, we talk about a lot on the show how important your wheelchair is, and getting in the right chair and having a team that understands our needs and how important this piece of equipment is to our independence and function in our daily life. And they're certainly an awesome company that takes that into incredibly serious consideration, providing you quality service and meaningful individuals that care a lot about your well-being and your function and your independence and can get you in the right equipment. And we've been talking about it for the last hour, but in case you don't know. Everyone's got to pee, and sometimes we got to use some tools to help us facilitate that. And the Urology Professionals, their sister company, has anything and everything catheter, urological supply related, everything that we've talked about on the show. Suprapubic supplies, straight catheter supplies, lubricant, the like. They got it all. Um, and they're national. So anywhere in the US of A, if you find yourself in need of a new company to get regular, reliable supplies, they're your people. Highly encourage you to give them a call. They can help with the insurance change. They can help figure out your insurance and talk to them on your behalf and get you the supplies that you need regularly and on time in a quantity that makes it so you don't got to stress at the end of the month wondering if you're going to have enough. So
Hey,
go give them some
Tom.
love and check them out. Yeah,
Hey, Tom, could I say something about urology professionals and
go ahead.
mobility? When you call, we talked about catheters all day. This is a good time to ask the professionals and what types of catheters that might better suit you if you're having problems, lots of UTIs. There might be a better catheter out there. A lot of times, like we were talking about earlier, we don't ask the doctor, but they're not the doctor, but they have great advice because they deal with all these products. And they have great knowledge, and they have individuals that are using these products. So they know, check them out. If you want to know more, one of our reps through Mobility Professionals and Urology Professionals, D. McCabe, was on the Rolling Over the Hill show, and he did it all about the catheters that are out there for men and women. That was about 3 months ago. So look in our archives and check out Dean's show.
And also call them. They will send you samples too if you want to try different catheters. So they'll just ship you out samples if you need them as well. So thank you to our sponsors. We appreciate you guys. All right, now for the shows coming up in the week, we got coming up tomorrow, T Fizzle Gaming. And
And it should be tomorrow this time.
oh yeah,
I
Thursday. Sorry.
have no. I think I've talked to my nurse and got her to come a couple hours earlier and stuff. I think I can do. I don't want to have to change the banner. I think we'll try to stick to the regular Wednesday schedule. I think I appreciate you guys bearing with me the last couple weeks. I've just been going through some scheduling changes with some caregivers and stuff and trying to figure that out. But I think we're good for Wednesday.
Okay. I
So
will make
yeah,
sure. I think I actually put it for Thursday because I wasn't sure last week. So I'll make sure I will.
okay.
I'll switch it up
It's all
for
good. I apologize, Shawn. I'm making your job harder, but I appreciate your understanding and everyone's flexibility and still coming by to hang out with us in game. Come and hang out with us in game. I was talking to Shawn before the show. We're maybe going to be getting him gaming soon. We're going to be hanging out and having fun like we do every week with a great crew of people. And it's more than just gaming. You just want to come and talk and hang. We're doing a lot of that too. So come and say what's up
yeah, it's fun, and I definitely do want to try to
tomorrow.
join in soon. So yeah, pop in tomorrow, check it out. I will switch the date on it today and get it. It'll be set up for tomorrow. So tune in for Tom's Gaming, and then on Thursday we got Bobby coming back again with Robert and Luis for another Rolling Over the Hill this Thursday. So make sure to tune in, check them out at 3 p.m. on Thursday. What do you guys have a guest?
Colostomy.
Okay.
I'm hoping to have a gentleman, two guys, who have already done it, and hopefully maybe one more gentleman that is about to get one.
Well, that sounds pretty shitty. I'm just kidding. Sorry, Bobby.
We're talking about the
That's
boob.
good. That's good.
I had to do it. I had to do it.
And then also coming up on other Thursdays, the following Thursday, we will actually have, there it is, Brianna, Nikki, Ashley, Maya, and Jessica all coming on to do some Wheel Girl Talk. I'm not sure what their topic is, but they always do really just fun conversations. It is very much of a girl chat, but they're fun, cool, and they like to share a lot of stuff that they're going through and dealing with in their life. So make sure to check them out next Thursday as well. And then also make sure we get in. Oops, that's you guys again. The Rolling with the Golden Oldies will be back on the first Thursday. And last Thursday, they were just on talking about kind of just a little bit of everything. They're talking about just life with disability, the aging, a little bit of like taking pride in yourself since it was like the day after the disability pride stuff. So just kind of talked about a lot of that great stuff. So check that out if you haven't seen it already. Oops. And then lastly, we do have Hell Wheels, Rob, doing some gaming. He's had a lot of health issues this last couple months, so trying to get him on when he can. But right now he's been in and out of the hospital and on antibiotics and things like that. So we all know what the struggles of that is. And then Mark, the game Tom plays usually is Fortnite. I just started trying to learn how to play The Last of Us, like the first one. So that's it's an older game, but it's really fun. I love the show. So
Amazing thing about that game, and just check it out, Sean. And again, I don't want to talk about this too long on live. Is it won? Last of Us 2 won most accessible game of the year because of all the accessibility that they have programmed into the game itself. So it's not like a controller adaptation, but it's actually stuff that they programmed into the game to make movement and interacting with your character and stuff a lot easier. So check it out. I think you'd be surprised at how accessible it might be for you. And yes, we play Fortnite because it's free. Anyone can download it and join it. Fall Guys is another free game that you can download and join. What we play sometimes. We also play Minecraft sometimes, or have in the past with Viv. So we mix it up, but mostly Fortnite because it's free and accessible for everyone to come and join. And I highly encourage y'all to do so if you feel like joining.
yeah, and if Mark, if you do want to try to hop on with him, I can send you the link for, and we'll post it in the Mark Network app. We've been trying to use the app and share on there as well stuff. So we'll post Tom's game stream, and you can shoot him a message and try to hop on with him. It'd be fun to hear the Boston
Yeah,
accent.
heck yeah. And I've played Rainbow Six in the past. We might be able to get down on that too to mix things up.
All right. Heck yeah, guys. So we'll tune in tomorrow for some gaming. Should be a lot of fun. And I'm going to try to work on my gaming so I can not look terrible when I join in a little bit here. So
Don't worry, you got the pro in the building. I'll coach you well. Don't worry, Sean.
awesome, man. All right, guys. Thank you, everybody, for watching. We appreciate you guys coming and hanging out. Make sure to tune back in tomorrow, next week, all the days, Thursday, Monday to Thursday. Turn that subscribe little bell on so you get the notifications. And yeah, live to roll, everybody.